Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the perspective of busy life schedule in a modern society, accepted minimum period of sexual cohabitation resulting in no offspring of a couple to be declared infertile is 1 year. Infertility is seen in fibroid uterus, endometriosis, adenomyosis and pelvic inflammatory disease. You see infertility. Common causes of infertility are chlamydia, gonorrhea, and mycoplasma are the common causes of infertility. Then prognosis. Best prognosis in infertile women is seen in reversible form of infertility is anovulation. Anovulation is the best prognosis in infertile women which is seen in reversible form of infertility.
Tubal block, oligospermia, and endometritis are have bad prognosis and they are not as reversible as that of anovulation. Anovulation can be reversible by just drugs.
Then TB. See, best prognosis in infertile women is seen or most reversible form of infertility. Best prognosis is anovulation. Even the most reversible form of infertility is also anovulation.
thank you and thank you for watching.